More than a dozen workers at St. Joe Hospital lost their jobs today. A hospital spokesman says the cuts will increase efficiency, but those laid off say it'll only hurt the patients. News Channel 15's Aisha Husney broke the story at 5, and she's back now with more news on our economy.
Well, Heather, one by one, 15 workers at St. Joe Hospital were asked to pack up their belongings today and say their goodbyes. Those employees worked at the Behavioral Health Assessment Office. Their job was to see patients with mental health issues and then decide what treatment they needed. A spokesman for the hospital says the cuts essentially take out the middleman. Patients will now go straight to a doctor who will decide what type of care they need. We spoke to one of the laid-off workers today just after she got the boot. She didn't want to be identified, but she told us the entire department is more worried about the patients than themselves. She says patients will be an added load on ER nurses who aren't as familiar with mental health issues as they are.
Our whole department has a lot of concerns about it because it's really, when you work with behavioral health patients, you're really working with a population that is fragile in some respects, and you really have to want to work with this population to work with them. So we chose to be in these professions, licensed clinical therapists and licensed social workers and non-licensed social workers at the master's level as well. So it's kind of a blow to our profession in general because it's kind of minimizing what we do and saying that, you know, we can train anybody to do this job.
Now, it's not clear if any of those workers received severance packages, but they will be able to apply for open positions within the Lutheran Health Network.
Okay. Thank you very much, Aisha.